If you are over 60 and you suddenly feel dizzy, the first thing you want is for it to stop. The room spins. Your balance disappears. Your stomach turns. Your heart starts racing because you wonder, is this my blood pressure? Is this my ear? Is this a stroke? Am I going to fall? Dizziness can be frightening because it makes you feel like you cannot trust your own body. But here's the most important thing to understand. Dizziness is not one problem. It is a symptom. And the first question is not, how do I stop it in minutes? The first question is, what kind of dizziness is this? Because the dizziness that happens when you roll over in bed is not always the same as the dizziness that happens when you stand up too fast. And the dizziness that comes with blurry vision, one-sided weakness, slurred speech, chest pain, or a severe headache is not something to treat at home. That is why today, here at Sharp 50S, I want to walk you through the most common dizziness patterns after 60, what they may mean, and what safe first steps you can take. Not panic, not guessing, not forcing exercises when you do not know the cause, just learning the pattern. Because when you can describe your dizziness clearly, you can have a much better conversation with your doctor. Before we go further, please hear this clearly. If dizziness appears suddenly with weakness or numbness on one side of the body, trouble speaking, confusion, sudden vision loss, severe loss of coordination, fainting, chest pain, or the worst headache of your life, seek emergency help right away. Do not wait to see if it passes. Do not lie down and search online. Do not try and exercise. Those symptoms can be signs of something serious, including stroke or heart problems, and time matters. But if your dizziness is recurring, brief, positional, or linked to standing, walking, meals, dehydration, medications, or head movement, then understanding the pattern can help you know what to ask next. The first pattern is spinning dizziness. This is the type where the room feels like it is moving, even when you are still. Some people describe it as the ceiling spinning. Others say the bed flips. Some feel like they are being pulled to one side. This is often called vertigo. One common cause of brief spinning vertigo, especially after 60, is a condition called BPPV. That stands for benign paroxysmal positional vertigo. The name sounds complicated, but the idea is simple. Inside your inner ear, you have tiny balance sensors. In some people, tiny particles in the inner ear shift into the wrong place. Then, when you move your head in certain positions, your brain receives a false spinning signal. That is why BPPV often shows up when you roll over in bed, look up, bend down, or turn your head quickly. The spinning may feel intense, but it often lasts less than a minute. Then it settles. But the fear can last much longer. If this sounds like you, one of the best questions to ask your doctor, physical therapist, audiologist, or vestibular specialist is this: could this be BPPV? And has it been checked properly? BPPV is often treated with specific head and body movements called canalith repositioning maneuvers. You may have heard of the Epley maneuver. These movements are meant to guide the particles back where they belong. But I do not want you guessing at home, especially if you are older, frail, have neck problems, back problems, severe nausea, recent surgery, or a history of stroke. The right maneuver depends on which side and which canal is involved. So the safest message is this: if your dizziness is brief spinning triggered by rolling over or looking up, ask about BPPV. Do not just accept years of fear without asking the right question. The second pattern is lightheadedness when standing. This feels different from spinning. Instead of the room rotating, you may feel like you are about to faint. Your vision may darken. Your legs may feel weak. You may need to grab a chair or wall. It may happen when you rise from bed, stand after sitting, get out of a car, or stand in the bathroom at night. This can happen when blood pressure drops as you stand. Some people call this orthostatic hypotension. It can be related to dehydration, blood pressure medicine, heart rhythm problems, long bed rest, diabetes, nervous system changes, or simply standing too quickly. This pattern is important because falls often happen during these moments. A person gets up at night, feels lightheaded, tries to rush to the bathroom, and the next thing they know, they are on the floor. One safe first step is to slow the transition. Before getting out of bed, sit on the side of the bed for a moment. Move your ankles. Take a few calm breaths. Stand slowly. Hold a stable surface. Pause before walking. This is not a cure, but it can reduce sudden movement stress while you talk with your doctor. Also, Ask your doctor or pharmacist to review your medications. Some medicines can contribute to dizziness, especially blood pressure medicines, sleeping pills, anxiety medicines, pain medicines, and medications that affect fluid balance. Do not stop them on your own. Just ask, could any of my medicines be making me dizzy when I stand? That one question can be very helpful. The third pattern is unsteady walking. This is not always spinning. It may feel like walking on a soft floor, or like your feet are not giving your brain clear information, or like you need to touch furniture to feel safe. This kind of dizziness can come from many places: vision changes, inner ear problems, weak leg muscles, poor balance, numbness in the feet, neuropathy, low vitamin B12, medication effects, blood sugar changes, or simply not moving enough because you became afraid of falling. This is why dizziness after 60 should not be brushed off as just age. Age may increase risk, but there is often something specific to check. If you feel unsteady when walking, especially in the dark or on uneven ground, your body may not be getting enough reliable balance information. Your brain uses three main inputs to keep you steady. Your inner ears tell the brain where your head is moving. Your eyes show where you are in space. Your feet, legs, and joints tell the brain where your body is positioned. When one of those systems becomes weaker, the others have to work harder. That is why some people feel much more dizzy in the dark. The eyes are no longer helping as much. And that is why some people with numb feet feel more unsteady on soft carpet, grass, or uneven sidewalks. The ground information becomes less clear. So if you are often unsteady, do not only ask for dizziness pills. Ask for the cause to be investigated. Ask whether your eyes need checking. Ask whether your blood pressure changes when you stand. Ask whether your B12, vitamin D, blood sugar, and medications should be reviewed. Ask whether vestibular therapy or balance therapy could help. Sometimes the answer is not one pill. Sometimes the answer is finding which balance signal is failing. The fourth pattern is dizziness with headache, light sensitivity, or nausea. Some people think migraine always means a pounding headache, but that is not always true. There is a type of migraine where dizziness can be one of the main symptoms. Some people feel spinning, some feel rocking, some feel off balance for hours. Bright lights, busy stores, screens, loud sounds, or certain foods may make it worse. This can be confusing because the person may say, "But I do not have a terrible headache." Still, migraine can sometimes affect the balance system. If you have repeated dizziness episodes that last longer than a minute, especially with light sensitivity, sound sensitivity, nausea, motion sensitivity, or a history of migraine, it is worth asking your doctor whether vestibular migraine could be part of the picture. The fifth pattern is dizziness that continues after one scary episode. This is something many people do not understand, and it can feel very discouraging. A person has a real spinning episode. Maybe it was from the inner ear. Maybe it happened suddenly in bed. Maybe it was terrifying. The episode passes, but afterward the person never feels completely normal again. They begin holding their head stiff. They avoid turning quickly. They avoid grocery stores because the lights and movement feel overwhelming. They avoid walking outside because they fear another dizzy spell. They avoid social events. Little by little, life becomes smaller, and the dizziness becomes tied not only to the ear, but to the nervous system being on high alert. This does not mean the person is imagining it. It does not mean they are weak. It means the brain has learned to treat movement as danger. The body survived one scary dizziness episode, but the alarm system stayed switched on. In some people, this kind of ongoing dizziness may need vestibular rehabilitation, gentle exposure to movement, anxiety support, or therapy guided by trained professionals. The goal is not to tell yourself, "It is all in my head." The goal is to teach the brain, slowly and safely, movement can be safe again. That is a very different message. Now let's talk about what you can safely do first. The first step is to describe the dizziness clearly. Before your appointment, write down what it feels like. Is the room spinning? Do you feel faint? Do you feel off balance? Do you feel like you are floating? Does it happen when you roll over in bed? Does it happen when you stand up? Does it happen after meals? Does it happen in busy stores? Does it come with headache, hearing changes, ringing in the ears, nausea, chest pain, weakness, or vision changes? How long does it last? Seconds? Minutes? Hours? Most people walk into the doctor's office and say, "I'm dizzy." But the word dizzy can mean many different things. The more clearly you describe it, the easier it is for your doctor to look in the right direction. The second step is to protect yourself from falls. Until you know the cause, do not rush. Sit before standing. Stand before walking. Use lights at night. Keep a clear path to the bathroom. Remove loose rugs if they catch your feet. Keep a stable chair or railing nearby. Wear supportive shoes. If you use a cane or walker, use it proudly. Safety tools are not signs of weakness. They are tools for independence. The third step is to check the basics. Are you drinking enough fluids? Are you skipping meals? Is your blood sugar dropping? Are you taking new medications? Did your dizziness begin after a dose change? Are your glasses outdated? Do you feel worse in the dark? Do your feet feel numb? Have you had your hearing checked? Have your B12 or vitamin D levels been checked if your doctor thinks it is appropriate? These questions may sound simple, but they can uncover patterns that are easy to miss. The fourth step is to ask about the right kind of therapy. For some people, dizziness improves when the inner ear particles are repositioned by a trained clinician. For others, balance therapy helps the brain use visual, inner ear, and body position signals more effectively. For others, the issue may be blood pressure, medication, migraine, dehydration, anxiety after a scary episode, or another medical condition. The right treatment depends on the right cause. That is why guessing can waste time. Now, there are simple balance exercises that some people can do, but they must be done safely. One gentle starting point is a seated gaze exercise. Sit in a sturdy chair. Hold one finger or a pen in front of you at eye level. Keep your eyes focused on it. Slowly turn your head a little to the left and right while keeping your eyes on the target. Only move in a small range. Only do a few seconds at first. If symptoms become strong, stop. If you feel unsafe, do not continue. This type of exercise is often used to help the eyes and inner ear coordinate better, but it is not for every cause of dizziness. Another safe starting point for many people is supported standing. Stand near a counter or sturdy chair. Place your hands lightly on the support. Stand tall. Feel both feet on the floor. Hold for a few seconds, then sit down and rest. Do not close your eyes unless a professional tells you to. Do not practice balance in the middle of the room. Do not do it near stairs. The goal is not to prove bravery. The goal is to train safely. And if you have frequent dizziness, falls, fainting, severe vertigo, or a medical condition that affects balance, ask for professional guidance before doing exercises. Now, let's bring this together. Dizziness after 60 can come from the inner ear. It can come from blood pressure. It can come from medications. It can come from dehydration. It can come from vision problems. It can come from nerves in the feet. It can come from migraine. It can come from the brain staying on high alert after a scary episode. And sometimes, it can be a warning sign of something urgent. That is why the pattern matters. Spinning when rolling in bed is one pattern. Feeling faint when standing is another. Floating all day is another. Dizziness with speech trouble, weakness, chest pain, sudden vision loss, or severe headache is an emergency. Do not treat all dizziness the same. Learn your pattern. Write it down. Bring it to your doctor. Ask better questions. Before you go, if this video helped you understand dizziness more clearly, please tap the like button and subscribe to Sharp 50s. It helps more adults over 50 find calm, practical health information without fear. And I would love to hear from you in the comments. Tell us your age and where you are watching from. You can write, "I'm 68 watching from Ohio," or "I'm 75 watching from Manchester," or "I'm 82 watching from Ontario." And if dizziness has affected your walking, sleep, or confidence, you can simply write, "balance." Your comment may help another senior feel less alone. One final reminder, everything shared here is for educational purposes only. It is general health information and not a substitute for personal medical advice, diagnosis, or treatment. If you have new, severe, or repeated dizziness, speak with a qualified healthcare professional. And if dizziness comes with sudden weakness, trouble speaking, confusion, chest pain, fainting, sudden vision loss, severe loss of coordination, or the worst headache of your life, seek emergency help immediately. Dizziness is scary, but clarity helps. Do not panic. Do not ignore it. Learn the pattern. Protect yourself from falls. Ask the right questions. And take care of your balance before your world becomes smaller than it needs to be. I will see you in the next Sharp 50s video.